Assalamualaikum. Welcome to my channel Science and Medicine. So let's talk about the remaining doses of antihyperlipidemia. Third is fibrate or fibric acid derivatives, and the drug is fenofibrate with the brand name Tricor. So patient can take 40 to 200 mg of fenofibrate per oral every day. Fenofibrate is a prodrug, as you know, its absorption increases with the food. So patient can take fenofibrate with the food, and the half-life of fenofibrate is 20 hours. The next is gimfibrazil with the brand name Lopate. So gimfibrazil have many interaction with the other drugs, so patient can take gimfibrazil carefully. 600 mg tablet 2 times a day per oral. Next is cholesterol absorption inhibitor, and the drug is azatimib with the brand name Zetia, 10 mg. So 10 mg is a standard dose of azatimib. Doctor always recommended you azatimib 10 mg. Next is a combination of simvastatin and azatimib with the brand name Vitrine. So patient can take 10, 20, 40 mg of simvastatin with the 10 mg of azatimib. Next is vitamin B3 niacin. So the dosing frequency of vitamin B3 is different and it depends upon the treatment. If you have vitamin B3 deficiency, the dosing frequency is different, but we are talking about hyperlipidemia. So patient can take 1000 to 2000 mg every day for cholesterol. Maximum dose is 8000 mg every day. So vitamin B3 dosing always depend upon the treatment. Next is extended release niacin with the brand name Niaspan. Maximum dose 2000 mg every day. So extended release niacin can decrease the side effect, which is flushing, which is a common side effect when you take vitamin B3 or niacin. Thank you.